This is Jamaica, our Jamaica. We have got cool mountains and hot music, green fields, blue waters, pretty beaches, beautiful views everywhere you look. There's really no other place that seems to have so much of what everybody wants and needs. We have got new industries making new jobs. No wonder so many people come to Jamaica as strangers and go away as friends. And no wonder so many of our relatives who have gone abroad are so happy to come back home. Everywhere in the island you can see a friendly wave, a happy smile, and see our folks walking good. But things are not quite as rosy as we want them to be. Think about the children you see who walk around half hungry all the time. They never get a good start in life because there are too many of them in the family and not enough food or money to go around. Or how about the cultivator who cuts his leg with his machete, or mother who cuts herself on the washpan, and there is no one about who knows how to take care of the wound? Or the old folks who just cannot make it to the nearest clinic by themselves, and they have nobody to help them. And every day there are more babies being born, more mouths to feed, more bodies to care for, more schools to build, more jobs to find. In the country parts especially, it is often hard to get medical help when you need it. Clinics are far away and difficult to get to over bad roads. The clinics are often crowded. The plain truth is, we're still terribly short of doctors and nurses, and it takes many years to train them. Good health is everybody's concern. Jamaica's future depends on having a healthy people. Our greatest health need in Jamaica today is the lack of medical help and knowledge at the village level, in our homes and in our families. To help provide the health care that is so badly needed, especially in the country parts, the government has started a new program, a program of community health aids.
Well, our Department of Social and Preventive Medicine has been working for some time in the nearby village of Hermitage. And in recent years, we extended our services to the neighboring community of Augustown. This we did with limited resources. But in doing this, we involved the community from the outset in helping to plan the program. And from the community, we had volunteers who assisted us with the clinic. Then it occurred to us that at some stage it would be nice if these volunteers who were helping in various ways could be given some organized training so that they would be able to function more effectively. Our concept was that this training should be valuable to the aides in helping them to be the arms of the health nurse working in the community, our own public health nurse. The responsibilities of the aides, we often stress, was that they would work not alone but under the direct supervision of some professional worker, in our case the public health nurse. But we saw them as working as the arms also of community development workers, and in fact bridging the efforts in the community. In fact, they could be considered the first port of call for activities related not only to health but community development.
We have recently introduced a new system of healthcare delivery in Jamaica, which involves the use of community health aides. We have therefore taken the decision in government to implement it substantially. In the first place, to cover the parishes of Hanover and St. James, and also to cover a substantial portion of the city of Kingston in the areas of greatest need. And this is the manual of the training program. You'll see it is quite a comprehensive manual that covers a number of what we describe as modular skills with which these people will be equipped. And here is Nurse Manahan, who is our senior public health nurse, in fact the principal nursing officer in charge of the public health program, and who is in fact in charge of this program. Now, I want you to understand that this program falls under the professionals. It will fall under the public health nurses, so that the community health aides will be trained by the public health nurses. They will be responsible to the public health nurses, so that we are not fragmenting the general responsibilities.
I'm going to dress it for you today, but you must take her to the clinic.
Yes, yes.
Tomorrow you must take her up to see doctor.
All right.
Community health aides will work in the village where they live. They will bring health care and advice to the families in their own areas.
This thing that I'm putting on here is acroflavin.
Yes.
Acroflavin. Yes. Can you remember what you gave Angela for lunch yesterday?
Well, for lunch, him get the same, porridge.
Porridge?
Yes.
What kind of porridge?
Cornmeal.
Cornmeal?
Yes.
Fine. What kind of milk did you put in the porridge?
Dry milk.
Dried skim milk?
Yes.
Oh, fine.
Yes.
Anything else that you can remember for lunch yesterday that you gave Angela?
And some biscuits.
Biscuits?
Yes.
Fine. How many children have you got, Mrs. Thompson?
I have 8 children.
8 children?
Yes.
Mrs. Thompson, what are you doing about it? You want to go to Eldersley?
Yes, next month. I want to start it.
You didn't go there since you have the last child?
No.
Why you didn't? Don't you know that delay is dangerous?
Yes, that is true.
Well, Mrs. Thompson.
But you have a sick baby, that's why I carry her up and down all the time, so.
Well, with all the sick baby, Mrs. Thompson, delay is dangerous. And what I'm advising you, Mrs. Thompson, is that you go to the family planning clinic in Eldersley.
Yes.
You will meet with the officers there, the family planning officers, and they will be able to tell you much about it.
Yes.
Even more than what I would be
Thank
able to tell you.
Yes.
And you'll get all the information that you need. Then, Mrs. Thompson.
Yes.
What about the baby's father? Is the baby's father supporting the child?
No.
Oh, imagine the baby's father is not supporting the child. Then how you believe that you will get along with so many children?
I don't know. I have to go and look work.
And if you have a baby, you cannot look work
No,
with a
can't
baby?
go.
Well, you see the sense in what I'm saying to you. You see the sense in what I'm saying to you?
Yes, yes.
And you are going to promise me. You are promising me that I'll see you at the family planning.
Yes, I hope to go up there next month.
Promise me that I will see you there.
Yes, and leave something up there good for me.
That's
very
fine.
Nice.
That you'll get. That you'll get.
The community health aides will work closely with the public health nurse and leading citizens who take an interest in community health matters.
Today, Mrs. Isilda Gordon.
Yes.
And she's a new community health aide.
Yes.
You know, will be working in this area.
Yeah.
She has undergone a period of 8 weeks training, and she is expected to do those duties that do not need the skill of a trained nurse.
Yeah.
I know that you are a person who is always very interested in the health of the community.
Oh, yeah.
And the whole well-being of the community.
Yeah.
And that is especially, like I've always come to talk to you about these people, I have brought Mrs. Gordon.
Yeah.
During her period of 8 weeks training, she has covered a number of subjects, important subjects, subjects that will help her to really help the people in her community. And she's very interested in this sort of a thing.
Yeah.
You know, she's covered subjects like first aid and bandaging, home nursing, knowing the common signs and symptoms of disease, knowing about the circulatory system and the digestive system. She has also covered, you know, things about her community health and knowing her community, knowing the people who live in her community and knowing the services that are available.
That's nice.
I'm sure you will find her a very interested person in the community at large, and I'm sure you will always find a work for her because you're always having your sick list and you're always wanting us to come in and
Let me
visit
hope
these
so.
people.
Let me
I'm
hope
sure
so.
she will be a
Let me
great
hope so.
help.
I'm delighted, Mrs. Gordon.
Many old people need special help. This old man is deaf and lives far away from the clinic. He has a sore on his leg. The community health aide is doing a dressing at his home until he can get back to the clinic.
Mrs. Skirvin, when is your appointment to go to the clinic?
The what?
Your appointment to go back to the hospital.
When I'm to go back there? I'm saying 3 weeks time.
3 weeks time. Please make sure that you remember that 3 weeks time you are to go back to see the doctor. Okay?
Good health starts early. That is why we have well baby clinics, to provide care for mothers and babies, to make sure they stay healthy. The community health aides will help at these clinics.
So you're breastfeeding Angela at the moment. Well, we don't have any substitute towards breastfeeding. And at the moment, Angela can't take anything else now beside the breast. You don't give her anything else beside breast?
No, just leave them out when she train up. When she drink the breast milk and the cold, I give her some glucose.
Glucose, yes, that's right. Well, you see, you have to take all the balanced diet now. That's your baby can be properly fed, and you must get some rest.
Yes,
you must drink a lot of milk, that you can have plenty breast milk to feed your baby. You must eat a lot of vegetables and a lot of meat, and you must get a lot of rest, even half an hour rest each day, that your baby can be healthy and strong.
The real hope of Jamaica lies in the health of our children. Even with a good start in life, children need a lot to grow up healthy and strong. Sometimes, though, people don't know the right foods to feed their children. They need help in planning the children's diet. The community health aide is trained to give such help.
All these things are sterilized. See? Have the boiled water, the cold boiled water, and strain and the milk and everything.
Of course, healthy children are happy children. Too many children, too close together in a family, can cause health problems for mothers and for children, and hardships for grandmothers.
Okay? You can just look at it. 8 ounces. So the measuring cup.
With fewer children, there will be more food and clothes, more love and attention, more education, more of everything for every member of the family.
So give this to Carlo. Okay. That's the godmother for Carlo.
Carlo.
Mm-hmm.
Carlo,
He's the grandmother for
yes,
Carlo.
Yes, the grandmother. Yes.
And where is the mother?
Mother and son.
Is she married?
No, she's not married. Not as yet.
When community health aides come on their regular visits, they will also give you advice about family planning to help you better your life.
Advise her as a mother.
Yes.
And, because you can tell her that if you are having children in now, you wouldn't have so many, and you throw them here and you throw them there, and you ask somebody, to take care of them.
Sure.
And, you put them at the street side.
Right.
Abandon them. It's not looking good.
Life doesn't always go smoothly. When you're old or sick or can't work, sometimes you need a helping hand to get back on your feet. Community health aides are trained to help old folks like this old man. He recently came home from the hospital. He had a stroke, and the community health aide is helping him to exercise his arms and legs every day so he may get back his strength.
Open the fingers. Open them. Open them. Open them. Open them.
Community health aides know where and when to go for the right medical help.
You see, I was looking for you to come to the clinic with Gerald, and I don't see him come, and you've been complaining that Gerald has a cold in his head. So I come this morning. I'm not leaving you. You are going to the clinic to see the doctor this morning. Yes, you see, in your condition, I was wondering if you wasn't feeling well, that I could take him up for you. But since you are coming, we will go along to the clinic. So you must remember to give Gerald his medicine. And it's important now for you to have all the rest you can. For with this baby coming, probably you're going to have to neglect Gerald. So you must see to it that he get his feeding properly, see him like the new coming baby. Give him eggs when you can. Give him things from the family pot as usual. Give him his milk, cheese, even saltfish if he wants it. You have a lot of protein in saltfish.
Even though our training out here is so good in medical school, we're quite incapable of communicating adequately with the patient. As an example of how the aid can be an extension of the work that a doctor or nurse can do, let us just focus for a minute on a problem like I had this morning, right here in the clinic. We have a malnourished child, somebody who's vomiting, having diarrhea, and the mother is doing the best she can to feed the child. But her best consists of giving the child glucose water, which, when a child is vomiting, is a good thing to do. But the stage is now reached where the mother has had this child in glucose water for about 2 weeks. The thing is that she was told to put the child in glucose water when it was vomiting, but she didn't understand to take it off when the vomiting had stopped. So we now have a mother with a problem of a child who is no longer vomiting, but who's heading for protein malnutrition. And this is where the aid comes in, because she could have explained to the mother what is going on. In the follow-up with regard to the patient, she would have gone and seen.
This community health aid program, which has started in St. Elizabeth, Hanover, and St. James, will bring basic health care to your homes. It will make it possible to bring to the local village level on a regular basis modern medical care and knowledge, not only about the growth and development of the child, but also the everyday care of minor ailments for both young and old. As we have seen, the community health aid has been well trained in such health areas as first aid, family planning counseling, the feeding and care of infants and old people, and maternal and child care. They will work directly under the supervision of the public health nurse. They are accepted by the whole medical profession and are recognized as a valuable addition to the health team. Your community health aide will be your neighbor and your friend, someone near at hand you can turn to when you need help. She will be your first port of call for health problems and health information. Look out for her. She will be wearing this badge. She will be your helper.